Webinar, resilience and gratitude, or stress and burnout. What are you offering your workforce? Did you know that nearly 1 in 4 employees say that their job is the #1 stressor in their lives? Burnout, stress, a loneliness epidemic. Our workforces are dealing with a lot these days. So we want to know, what are you offering your organization? Is it resilience and gratitude, or is it stress and burnout? During today's webinar, we have a panel of experts that are going to give you the tools to become a resilient person and help you create a strategy to empower your workforce. So let's get started. First, I want to introduce myself. So my name is Julie Mallory, and I will be your host and moderator for today's webinar. And there's just a couple of housekeeping items that I want to go through before we get started. We are going to cover a lot of information today, and this webinar is being recorded. So you will get a recording emailed to you in the coming days so you can go back and listen or share it with your colleagues. This is going to also be an interactive webinar. So we've transformed our Q&A box into a Q&A and chat box. So you can ask your questions there, but also please use it for our upcoming chat session. And then you will also find a number of additional resources that you might find a little helpful on the left-hand side of your screen. There's a blog post with some great resiliency takeaways and practices, a survey so that you can help get a pulse on your employees' emotional health, an informative ebook that will give you some mental health tactics that work. Also, following today's webinar, there's going to be a survey that will pop up to share your feedback on the information that we shared with you today. It shouldn't take more than a minute to complete, but we really would love all of your feedback. We use this information to help create content to share with you in the future. So we hope that you will help us by completing it. Okay, let's meet today's speakers. So first we have Alana Fink. Alana is the Executive Director of Content and Learning at Equilibrium, the #1 resilience building system. She's a resilient expert and a board-certified health coach trained at Duke University. In her role, she trains people around the world in skills of science and resilience, and will give you a lot to think about following today's webinar. Alana, welcome. We're so happy that you're here.
Thank you for having me. Very excited to be here.
And then we have Bria Galley. She is the Vice President of Growth, Partnership, and Consultant Relations at Wellbeats, which provides on-demand fitness, mindfulness, and nutrition. And in her role, she works closely with partners to drive approachable well-being solutions to meet the needs of diverse populations. And she's going to provide you all with some solutions today as well. Hey, Bria, welcome.
Hi, everyone. Thank you so much for having me. Thanks, Julie.
Absolutely. Absolutely. And then we have Amy Fink rounding out our panel. She's a senior lifestyle coach here at WebMD Health Services, which has been providing health and well-being solutions for employers and health plans for over 20 years. As a WebMD coach, she's conducted nearly 32,000 coaching sessions, and she's currently part of our clinical behavioral health team, which provides actionable solutions to combat stress and burnout. She's also a great addition to have on our panel. Hey, Amy, how are you?
Thank you, Julie. Hi, everyone. I'm so glad to share this time with you.
All right, let's get started. So first, we want to start with a polling question. Now, this is not going to be a time for everybody to multitask. We've got a lot of polling questions and a lot of interactive chat to go through in the next hour. So we want to know the first question. Do you feel encouraged to have conversations around mental health at work? Definitely, sometimes, or maybe. You can only choose one, so just click it right there on the screen. I'm interested to see what these results have to say. All right, let's see what you guys said. Oh my gosh, look at this. I think that this is really amazing. We have 47% that said definitely and 41% that say sometimes, which I think is huge. The maybes, just rounding it out with 12%, hopefully those maybes will come around at the end of our webinar today, feel a little bit more ready to have some conversations around mental health. But Alana, when we get started, I want to start with you because we had talked about this in our brainstorming session when we were talking about the webinar about how I'll get to this or I'll get to that when the dust settles. And yet we seem that the dust is never settling. So what do you have to say to that?
It's so true, and that is a point that our CEO at Equilibrium made. It was at the beginning of the year, and it just stuck with me. It says we keep waiting for the dust to settle, but guess what? It's not going to settle. And what we mean by that is just that there, as we all know, this is news to nobody, but I think it's really good to acknowledge it. Is that there are many sort of sources and forces of stress that are upon us and our employees and our organizations that can kind of make for, a stressful time. We've got economic uncertainty. Many of us, if not most of us, are going through incredible workplace transformation, whether that's figuring out how to work in a hybrid way or something much, much larger. Many of us are going through much, much larger, even larger transformations, and uncertainty and change are some of the top human stressors of all time. There's increased violence around the world and in the workplace. We're still dealing with the outflow of the pandemic. My parents just got COVID a couple of months ago at a family wedding. It's not front and center anymore, but it is still straggling around. So, there's a lot happening in the world, happening in our lives, happening in the world of work, and we're feeling it. We see data in Equilibrium. We see data, in the APA, World Health Organization, all showing burnout is up, anxiety. We see World Health Organization showing that anxiety and depression is up. 25 and 27% of us are feeling either of those at any one time. We're seeing burnout sitting around, at Equilibrium. We're seeing for some of our customers, in the high 60% range. The APA was showing in one study, 79% of us are feeling burned out some or most of the time. So, there's, and I know that folks are seeing it in their data as well. We know that our people are feeling burned out. And I want to just point out that managers, we want to pay special attention to. Equilibrium just did a study. We're calling it Manager in the Middle, and we're seeing this data kind of echoed out in the world as well, where we're seeing managers experiencing burnout at a higher rate, 18% higher rate actually than individual contributors. We know managers are feeling pulled in both directions, dealing with hybrid teams, not really sure how to navigate, having to be amazing executors, but also strategic visionaries. And, these two forces just put a lot on the manager's plate. And so we need to upskill our people. And, our choice factor here at Equilibrium is around resilience. And we'll be sharing a little bit more about what resilience is and how it can support us. But it's a tool and a skill that anyone can build. It's not something you're born with or not born with. And it really helps us not just manage uncertainty and change and challenge, but it actually can support us in thriving in our personal lives and our professional lives. We are, as we were talking about earlier, the #1 resilience building system. We're based on over 25 years of research, data, and proprietary science. We are focused on preventing and looking at a root cause of issues. For example, we understand why that call center, for example, may not be performing because 67% are burned out, right? We can not only uncover insights about your human capital, but we can also mitigate for those through our skill building. So we are a data company, being able to glean incredibly important data around our human capital. And we're also a solution to help mitigate for those through skill building and our app and our desktop solution. And we have, three main components, lots of goodness in Equilibrium, but three main components. We have a solution for individuals with individual resilience building, those individual skills to increase our focus, increase our work performance, manage our stress, manage burnout, get more self-care in our lives, right? Then we have a solution for teams and managers because, hey, we're all working on a team and we want to address those managers I was mentioning just a few moments ago in specific. How can we upskill managers and teams to be able to surf the uncertainty, the change, the stress, that we all sort of deal with in the flow of work, and applying that same proprietary science to teams and managers. And then, as I mentioned just a moment ago, we harvest incredible data around our human capital, around our organizations, and we deliver that to you in insights that help you make the most important strategic decisions around your people and your organization. Next person.
Thank you, Alana, so much. I appreciate it. I know I'm really excited about what we're going to talk about, what you're going to be able to share today. And Bria, I want to talk to you because I know that Wellbeats conducted some research earlier in 2021 regarding burnout and resilience, and then you completed it again and you compared that research. What did you find this year compared to 2021?
Yeah, absolutely. Yeah, we compiled a white paper specifically looking at burnout and how that was impacting people in the workplace. And actually, the World Health Organization defines burnout now as a syndrome resulting from chronic workplace stress that hasn't been successfully managed. So we really wanted to look at what was happening. So in 2022, we basically looked at 2021 data, of course, and research found that almost 90% at that time of people have either experienced burnout on some level or are currently experiencing burnout, which is quite staggering. Alana just mentioned a couple updated stats around that. And the other really key thing that was happening around burnout is an average in 2021, an average of 3.9 million workers were quitting their jobs on average a month. And burnout was the main cause. So high turnover with a association with burnout. And when we looked at the data for 2022 around the same research, unfortunately, the trend has not let up. It's actually increased. It's closer to 4 million now on average, people leaving their jobs. And currently, burnout is the number one reason people are leaving their workplaces. So it's obviously a huge component to what people are experiencing and obviously impacting them individually and our organizations as well. And we'll get into this more today, but I think it's easy to think of burnout as a personal only issue. I mean, there's certainly things that we can do, and we're going to dive into that today. But it's also something organizationally that we can look at on that level as well. And it's also not an easy fix. It's not, hey, let's get one good night's sleep and you'll be fine. It's something just like exercise. Or other things that we train for, we need to work on and build over time. And the good news is there are things that you can do on an individual basis and organizationally to both prevent and or improve burnout. And one example, when we think about physical activity and the benefits and how we use physical activity to improve health, I think we all know it, there's physical benefits. There's been research for years now around the physiological aspects or benefits of exercise. But now I'd say over the last 10-ish years, we're starting to really see some solid research around that connection with mental health benefits. And just to give you an example, a couple of our clients, Duke University and Mayo Clinic, in conjunction with Harvard, recently did some studies, and they found, one study found 10 days of exercise within a month can be equivalent to taking an antidepressant. So we know there's a strong mind-body connection, when it comes to well-being, which is why at Wellbeats, we really take a whole person well-being approach. And a key part of that is we really believe that well-being isn't just for some people, it's for everybody. So we really focus on providing a non-intimidating, accessible first step, meeting people where they are, no matter, your age, body type, ability level. And we do that through our app and web portal, which include a diverse library of content focused around fitness, nutrition, and mindfulness. And we do classes as well as programs, and they're all led by certified, relatable instructors. And that way, no matter, your interest levels or, whether you want to dive into our recipe or our functional nutrition library, or do an activity class, maybe with your kids. If you have kids, we have something for the entire family. And that's just one way in which we're solving for and supporting our clients specifically around topics like burnout.
That's great, Bria. Thanks. Yeah, we used one of your Wellbeats workout sessions at our recent client forum event that we had, and we all just had a blast with it. There was a lot of laughter. It was a great way to break up the day. It was really great. So thanks. I'm excited to hear more about what you have to say later on the webinar. Amy, I want to kick it over to you because WebMD Health Services, we have been incredibly busy. We just reached a major milestone when it comes to our coaching sessions this year. And last year, I know that we implemented our clinical behavior team. Talk to us about both, and I'm interested to know what changes your team has seen since we started offering that clinical behavior coaching.
Yes, I'm super, super excited to announce that we just reached our 6 millionth coaching call just last week. And just to put that in perspective, that's about 3/4 of the population of New York City. So we're very proud that we have helped to impact so many lives already. And in March of 2022, WebMD launched the Clinical Behavioral Health Team. It was due to us seeing and hearing participants reporting more and more that they had anxiety and depression symptoms. They were also discussing that they had an increase in feeling like their mental health needs were not being met due to lack of services. For example, we were hearing, I want to talk with my provider, but I called and their next availability is in 2 months. So WebMD stepped up to the plate and we implemented this team. The team consists of coaches that have over 20 years of education and experience in mental health issues and stress management. And our goal as a team is to help participants manage their mental health issues and stress better and improve their emotional health. We're also finding that we're bridging that gap by providing support while participants are waiting for their provider. So they may have an appointment in 2 months, but we're bridging that gap and giving them support in between. And I'm so happy to report it is working after a year in. If you look at the bottom of the slide in our 2022 report, within 1 year, our participants reported they feel their ability to deal with stress has increased by 10.6%, and they feel their overall stress has been reduced by 12.8%. This may look like small numbers, but when dealing with stress and mental health, it's hard. It takes time, it takes effort, it takes commitment, it also takes support. And we were very excited to see the impact that we've had in people's lives in just 1 year. The other thing I wanted to mention is there's been a huge uptick of participants that are dealing with loss in their life. We talked about the dust not settling, and part of that is loss, right? We're grieving that uncertainty. And in 2020, there were over 500,000 more deaths in the United States than the previous year. And yes, that was a pandemic year. But if you look at the numbers for 2021 and 2022, the numbers haven't changed much. So if you do the math, that in the last 3 years, 1.5 million more deaths happened in the United States. And then when you think about that further, think about how many people that has affected. So we're dealing with a lot of loss, a lot of grieving, and a lot of chronic stress right now. And when you think about those 3 topics, it's like a computer program running in the background of your computer. It is always using up energy even when you're not focused on it. So when you talk about burnout and you're grieving or you have anxiety or you have a depression, that's like that energy be using up in the background while you're trying to focus on your work. That is why it's so important to use resiliency skills and self-care to refuel that loss of energy that you may be feeling. I wanted to just leave you with 3 things that management, your employees can use. These 3 things to ask if a fellow employee may be going through a difficult time, or maybe you're going through a difficult time. So the first one is to ask yourself, are your basic needs being met? Are you getting enough sleep? Are you eating? Are you eating properly? Are you hydrated? And then ask yourself, do you have support? Do you have support at home? Do you have support at work? Do you have online support? Do you have community support? Do you have a health coach? Looking for that support to help you through that difficult time. And then third, how can you create a self-care plan? What do you need to do on a daily basis when things get difficult? And this can be a really good centering tool too. So when you are feeling overwhelmed and you're not sure what to do for your strategies, just going back to that basic, are your basic needs being met? Asking yourself that again. Have I been utilizing my support? So it can be used as a very good centering tool too when you're feeling overwhelmed and you haven't been using your strategies.
That's great tips and great advice, Amy. Thank you so much. Okay, so now segueing into that, we have another audience polling question, and we want to know, honestly, how many of you feel that your tank is empty before you even sit down to your first meeting? Yes or no? How many of you feel like your tank is empty before you even sit down to your first meeting? Mine depends on the day, but sometimes just. But let's see, Alana. Let's see what this.
Oh, I can jump in a little on context for that too. Just feeling when we feel like our tank is empty before we even sit down for our first meeting, it's like we're dealing with the stress of maybe parents or caregiving, our children, finances, worrying about the future of the world, and all of this. And a lot of us are managing a lot of things in our lives, and we're dealing with a lot before we even get to that first meeting or our first task at work. And a lot of us feel like, I'm just kind of exhausted when I go to sit down for my first piece of work, right? Yeah.
And look at that, it's half and half. I mean, it's really split. So talk to us a little bit more about how, I mean, we hear this all the time, but then sometimes it's really hard to take your own advice. Like the way that we start our day sets the tone for the day. Talk to us a little bit more about that, Alana.
Yeah, I want to just build on the great things that everyone has been saying, Bria and Amy, and that self-care is absolutely critical for our well-being, for our resilience, just for us as humans, and a lot of us tend to put self-care on a list, and then we don't get to the end of that list. It keeps falling to the bottom, and then we push it off, and we have good intentions, but we get busy, and it's just sort of the thing that's last, and then we never get there. But, self-care is not a luxury. It is a necessity. And it's not something that you gift yourself once or twice a month, or you let yourself do once you finish everything else. It is small acts we do each and every day to refill our tank, right? And we are just like cars. When the cars run out of gas, they will break down, and when we run out of gas, eventually we will hit burnout. And so we've got to refill the tank. And I've got another car analogy for you when it comes to self-care that I want to share. When we're getting on the road, we're taking a road trip, we don't think anything of pulling off, as halfway down the track to refill the car with gas, right? Because that if you don't refill the car with gas, you will not make it to your destination. But when it comes to ourselves, we have a hard time kind of pulling off the highway sometimes and refilling that tank. So it's just a nice visual picture to remind ourselves, hey, we think nothing of pulling off and refilling our car. Let's pull off ourselves and refill our tank too. And I like to say that the way, as Julie mentioned, the way we start our day sets the tone for our day. So I don't know if you in chat anyone want to fess up who rolled over first thing in the morning this morning and checked your phone? Who rolled over? Julie, I'm getting a nod. So, it's not good nor bad. It just is what it is, right? And for most of us, we're on social, we're on news feeds, we're checking email, we're literally putting ourselves in the stress zone, and we haven't gotten out of bed yet, Right. And that sets the trajectory of our day. So, it's things like this. Right. I'm seeing Katie saying, and Michael, Christine, yes, everyone, Michelle. Yeah, I know. You're not alone. Right. Carol's like bad habit, all caps. Right. Yeah. And, it does for most of us, maybe not 100%, but for, 90 some odd percent of us, it's going to put us in the stress zone, and we haven't even had our coffee yet or what have you, so these little things we can do. Could you put your phone across the room or just not check it when you get up? Just have those moments for yourself to have a quiet moment, journal, reflect, have a meditation, whatever works for you, but to make sure you're doing something in the morning for you, whether you've got a minute or 15 minutes, right? I do something in the morning for myself every morning, whether I have a minute and I'm just jotting down a couple of positive things going on in my life in my journal, or whether I get time to do a meditation and some stretching or what have you. So, this is absolutely critical. When it comes to resilience, this is in our well-being in general, this is a critical piece. Our brains are sort of wired to focus on the negative. Our brains are wired more easily, frankly, to feel stressed. Why? Well, it kept us alive when we were being chased by saber-toothed tigers. And while we don't need that capacity anymore today, we are still wired that way, as many of us know. So what does that mean? It just means we are wired to feel things like anxiety and stress and sadness and frustration and anger more easily than things like happiness. And, but the good news is that our brain is very amenable to change. It's called neuroplasticity. And, we're going to share a technique with you in a little bit about how we can sort of work to manage this negativity bias and thereby manage our stress. But, self-care is just an absolutely critical piece of the puzzle.
Okay, so give us an example of what maybe like a team can do, or what you as a manager could maybe do to set your team up for success on a Monday.
One of my favorite things to do, thanks for asking that, Julie, is we track our wins. We do something called win lists, and this is an activity in Equilibrium. But, on our Monday morning scrum, before we get into everything we have to do for the week, I have the team just quickly go around the room and track their wins from the week before. And I don't know, give me a yes in the chat if by Monday morning you've forgotten like everything great that happened the week before or over the weekend. We all pretty much have. But, we did a lot of great work last week and we got through a lot. And it's completely transformed the culture of my team, and our own cultures. It's so simple, it's so easy, so quick. We just call out a win we had from the week before, whether it's the project you finished or you had a great meeting, with, a team manager or what have you. No matter how small, it all counts. But, we do this as a team, tracking our wins, sharing our wins, reminding ourselves as our wins. Why is this important? Because we will tend to skip over them. This negativity bias, we'll tend to focus on what we didn't get done, what's not going well, what didn't work. And, and so this sort of helps us recall and remember the good things happening. You can do this on your own with a simple notebook. You can do it in Equilibrium. You can do it as a team. Just have one of those simple things we can do to make sure we are not overlooking all the good stuff that we got going on.
I love that, Alana. And so we want to put it to the test right now. So we want all of our attendees using the Q&A/chat function. We want to know, so it's Thursday today, what is something that went well for you this week? And Alana, right, this can be personal, it can be professional, something that went well for you. I want you to just take a moment, write that in the chat. And while we're waiting for those answers to come in, I know you had just kind of talked about self-care, and we talk about this all the time of what it is and what it isn't. It's not a manicure. It's not a facial that I get. It's not a massage I get every 6 months. What is considered self-care? I want to start with you, Alana, on this.
Yeah, so self-care, as I kind of mentioned before, it's not, a massage you're getting once or twice a year or a bubble bath once a month. It's the little things you do each and every day to refill your tank. And if there's managers and leaders on this call today, I encourage you to model this for your teams. We know that our teams model the behavior that we exhibit. So we want to model, and this is one of the most powerful things we can do to prevent and recover from burnout. And I will share with you, we have an exercise in Equilibrium called Fill Your Tank. And this is an energy jar here. I've got it filled with Legos. I got about 60 pieces. And you can make your own, or do the activity once you all got equilibrium in your organization. But you take about 5 pieces out for every energy out, and you put 5 back in for every energy in. And you can use beads or cotton balls or paper clips, or I use Legos because my son has like 5 million, played with them for decades. But checking that phone first thing in the morning, that's energy out, right? Who has back-to-back meetings or calls, right? Who doesn't these days? Who has to handle spontaneous requests, right? We've all got those fireballs that come in our lap, right? This is energy out, energy out. We skip lunch because we're too busy. We don't get time to exercise. We don't have a healthy breakfast. Energy out, energy out, energy out. And you will see pretty quickly, if you're not monitoring it, that the tank is empty. And I'm a health coach. We love having a visual reminder. This is going to increase your adherence and your efficacy. So it may look cute and sweet, but it's actually an effective tool to help us make sure we take care of ourselves. So, the idea is, whether you keep this idea in your mind or you actually make your own energy jar, you want to keep a heuristic in your mind of tracking, hey, I just had 3 meetings in a row or 5 meetings in a row, and I literally haven't gotten up away from my desk. It's time, right? So it's things like,
I love that. Bria, I want to kick it over to you too, because I know that you had talked about, like in your opening, we know the importance of working out and, physical health and all of that, but it's also more than that. So what do you and Wellbeats have to say too about self-care?
Yeah, absolutely. I mean, I think what's important, and Alana mentioned this too, is sometimes when we think about self-care, even starting an exercise program or doing any behavioral change, I think we think of the ideal and what we, want to accomplish. Like, I want to be working out like an hour a day, but then that might not be realistic for us right away. So what are tiny little wins that we can acknowledge or schedule for ourselves, or have little bite-sized, videos or moments during the day where we can take a little time for ourselves? And we've actually seen this trend happen with our members. We used to, kind of pre-pandemic, our average class play used to be around 30 minutes. And now we've seen it shift to about 20 minutes, because we are seeing our members looking for bite-sized content, whether that's a moment for a breathing exercise or stretching, or, hey, I just want to, retrain your brain, which I believe is the video that your team did at your client forum. So there's a lot of need and requests now coming around that. So having bite-sized opportunities, finding ways to work it into your day-to-day so that you can, again, refuel your tank. And that can come from physical activity. We do a lot of focus on that, but it also can come from fueling your body from a nutrition aspect as well. And I know Elena mentioned that as well. That's such a critical piece. I'm notorious for not eating my lunch. And that's something that I personally have tried to, I've been focusing on, is making sure I take time to really fuel myself and take a moment throughout the day. So there's a lot of different ways you can approach it, depending on what your needs are and what you can, have access to, and then what you can weave in throughout your day. And you can also schedule things and create a calendar if you want to try to create a repetitive, kind of schedule or habit building within Wellbeats as well.
Bria, and speaking of that, we got a bunch of, and you guys just lit up our little chat here, so thank you. I want to read a couple of these off, and then Amy, I want to kick it on over to you. But Jennifer said that her son graduated from elementary school this week, and it was a reminder that I'm part of getting him to the point and beyond. To this, I parented well this week, LOL. Jennifer, I'm right there with you. Some people attended their second boot class, water class. Oh, I love that, Joni. Did a presentation to a group on current well-being programs. And then even though I had to say we could not do something an employee suggested, I was able to refer her to a local group instead of blowing her off. Jennifer, I love that. Small, I know, but it has been a bad week. But you know what? You found the silver lining there. I love that. David said that a candidate made a final step in the interview process. Getting back on track with my morning workout, says Pam. Another Pam said, making sure I'm in control of my health and eating well. Marcy said the weather is so great. Susan took a volunteer day off to support local animal shelter. I mean, this is like really incredible. My boss was on vacation, and so we had multiple people throughout the company tell me that they didn't even notice she was gone. Oh, gosh, Taylor, that has got to really make you feel great. My team took time away yesterday to step away and go to lunch to celebrate 4 birthdays. Melissa, that is amazing. Thank you all so much for, I mean, I could keep going on and on. This is just really incredible. Amy, what does this do to the brain when you hear such positive, stories?
I could tell you what it's doing to my arms. My hair on my arms is sticking up. I don't know if anybody else is feeling like that feeling of like excitement and just happiness just by hearing all of those wins. I saw one Pam got back to her morning walk, and I love my morning walk. I don't know what I would do without it. So I was like, yes, good job. But when you are thinking positive and you're acknowledging your wins and crossing off that accomplishment that you did on your to-do list, this releases dopamine into your brain. So you're getting a little boost for your mood and energy for the day. The research shows if you complete a task, that dopamine can help you to tackle those more daunting tasks. So when you're at work and you're struggling on a big project, try accomplishing a small task first, or breaking down that big project into something smaller that you can accomplish quickly. So you get that little boost from your dopamine to help you with those more tasking items that you have to do in your job. But for now, enjoy that mood boost you just received.
Amazing. I love it. Okay, now we want to kind of switch gears a little bit. This one, we're going to have you really kind of take a look inward in our next polling question here. And we want you to think about what happens to your body when you get stressed or during a time of uncertainty. Do you feel anxious? Do you feel angry? Maybe you're frustrated. Maybe you detach or disconnect. Maybe you thrive when it comes to stress and in time of uncertainty, or maybe something other than what is listed here. So really take a minute, think about how your body reacts when you get stressed or during a time of uncertainty. And I want to see these results. And then Alana, I want to throw it over to you because let's see what everyone has to say. I know you're going to give us some steps about ways that we can get through these hard times. So let's see what people say. Okay, most people are feeling anxious, angry, frustrated, detached. We had one lonely thriver out there, which I love that. But what are some tips? Talk us through that.
Yeah, sure. So we're talking about resilience and burnout today. We do know in our data at Mequilibrium that, I just love that. This is one of my favorite data points that we have at Mequilibrium. We know that people that are resilient are actually 60% less likely to suffer burnout, 60% than non-resilient people. So we measure, resilient and non-resilient and put them into quartiles. And so, resilience appears to have, a sort of a protective effect around burnout. And, what happens is when we get stressed is we sort of mentioned earlier that negativity bias, we kind of default to a negative emotion, right? Like anxiety or frustration or what have you. And we call it Mequilibrium our emotion radar, because what happens is you end up kind of scanning the world looking for, I'm an anxiety person. I don't know if there's any friends with me here today, anxiety friends. I'm always worried about what could or might happen. I And so, I'm sort of scanning the world, looking for something to worry about, looking for something to feel anxious about. And that's what basically our emotion radar is, because when you're scanning for something, you more often than not will find it, right? So we wanted to share with you today, Mequilibrium, sort of one of our core techniques around managing stress and boosting our resilience. And we call it Trap It, Map It, Zap It. And it's just a catchy name for a really powerful technique around, for any psychology buffs out there, around reframing. And I'm going to step us through it here, so we can go on to the next slide. I'll just step us through each step. So number one, you want to trap the emotion, because I don't know if you've ever noticed this, but we tend to feel an emotion before we even know we're thinking it. Give me a yes in chat if you've ever felt like the heavy weight of sadness. When we're sad, we literally, our body kind of like caves over. It feels like a weight, right? Or that tightness of anxiety, right? Like when I know when I'm anxious before I'm even thinking it, because my shoulders are tight. Sometimes I get butterflies in my stomach. It kind of clenches a bit. I'll clench my jaw, right? Like it's like, oh, our body is our early detection system that we're stressed. And so, you can use that now going forward from today on, and remember that, okay, wait, that heat of anger, you're flushed into your chest or your cheeks, we're angry, right? So, remember that. Use that power of the pause and check in. Hey, am I stressed right now? So we want to trap that emotion, right? Next slide, please. And then every emotion is actually driven by a thought. They're not just emotions sitting out there. They're actually all driven by a thought. And so we want to map that emotion to the exact thought that is driving our stress. And a lot of the times our thoughts are not accurate, and they're driving our stress unnecessarily. We'll go from 0 to 100 or A to Z. And here are some very good examples we've got on this slide here. Give me a yes in chat if you've ever done this one. You send the email or the text. You don't hear back in a time frame you think you should, like a minute or an hour or even the end of the day. And you're like, oh, they're mad at me. Oh, that was a terrible idea. And we'll just kind of circle the drain on that, right? Yeah, this is what I'm talking about. These kinds of examples, right? If I don't do this perfectly, I'm going to get fired. Oh, I'm such a loser. I always do this. These are the thoughts that we repeat over and over and over that drive a lot of our stress. So I want to map it to what is the thought driving that. Final slide, please. And then we want to zap it. And what we want to do is ask yourself, hey self, is this thought accurate? And if it's not, which a lot of the time it won't be, right? How could you rewrite that thought to be more accurate to the situation? All right, yeah, this was a team project and we all played a part in the mistake. It wasn't just me. I don't have to carry the weight, right, of this whole thing. I'm not fully to blame. Or, how could we rewrite that to serve us better? Now, if the thought is accurate, and goodness knows, in the last 3 years, we've had an absolute right to feel sad, angry, frustrated, anxious, what have you, all the feelings. How could you rewrite that thought to serve you better, to put you back in the driver's seat of your life, to feel better, right, when you are ready? And I share this because we do have the power and the control over that. For example, okay, this past year has been the hardest in my life, but I've gone through hard times before, and I'm going to get through this too, right? So really, it feels sort of complicated at first, but it's just like going to the gym. You get used to it real fast. And I do Trap It, Map It, Zap It. Like I do it like 40 times a day. Here's that stressful thought. What am I thinking? Okay, right? It just becomes easy. And this is how we keep our day-to-day stress in check. I will share that we have on average 60,000 thoughts a day. Yes. And 90% of them are the same day to day. Our brain is just, there's too much information coming at us for our brains to process. So it's really important that we have techniques such as these so we can manage our stress.
I love that. Bria, give us some examples on what we can do, that is what we can do for ourselves, right? We can retrain our brain that way. Bria, what are some things that we can do on the manager side of management style?
Yeah, absolutely. So I think it's key. I know we've touched on some individual tools and strategies you can use. And I actually loved your stat earlier, Alana, about it's unfortunate that managers are feeling burnout at a higher rate. So I think this is where, from an organization and a work environment space, there's some things that can be focused on and things that can be deployed to help with things like combating burnout or helping. And this can be all throughout the organization. I just wanted to share a couple from a management standpoint today, just to kind of get the conversation going. And one great example is when you're working with your team, and this can be true to yourself as well, is how do you build self-efficacy, their confidence in the work that they're doing. And a big part of that is understanding their skill sets. What are they good at, and how can you leverage and really celebrate that as part of the work that they're doing. Also fostering a positive employee experience, whether that's a part of a team, a larger team, or on an individual level. And a big part too is really effective communication, and that goes hand in hand with setting clear expectations. And this could be around roles, responsibilities, goals, individual goals, team goals, company goals. I think one of the biggest things that I've experienced in my career is not knowing what the company goal is. It kind of trickles down to, well, okay, how does that, if I don't know where we're flying the ship, how can I help steer it? So there's a lot of different ways of communicating that effectively, but really just keeping your team in the loop and trying to set as clear as possible expectations around what their job is and how they can contribute to the work that's being done. Another big piece is providing channels of feedback, communication, and resources to truly ensure employees feel supported, right? I think we all want to feel like we have a go-to person or go-to resources, whether that's in the work environment that's going to help me do my job better, or beyond too, right? So things that we've talked about today about how, when I take a break, is that going for a walk? Is it wanting to watch a little video? Is it stretching? I actually have a foam roller behind me. I try to do that myself. So what are those tools that we can also support our teams with? And then just removing as many barriers as possible, with the work that we do. And I know that can be easier said than done sometimes, but again, working through it together, that's a big part of it as well. And then the last example I wanted to share today too is providing mentorship. So creating go-to channels for guidance, advice, and support. So no one wants to feel like they're alone on an island, and being able to, whether it's you as the manager being that go-to person or setting up a mentorship program as part of your organization. There's a lot of different ways you could approach that one, but just providing those opportunities for employees and people that want to access them. So just a few different ways, again, organizationally, that you can approach or think about ways to kind of help with all of the things that we're talking about today: stress, resiliency, and combating burnout within your teams.
Amy, talk to us a little. Yeah, go ahead, Amy.
Sorry, I just wanted to talk a little bit about your resiliency roadmap and what that is. So if you want to drop in the chat, I want you to think about something you've been doing for yourself, but it's dropped off from your routine and you're not doing it anymore. Anything that you can think of. And basically this roadmap is to help you to reset and regroup when things get busy. So when you already have, hopefully you've been thinking about through the presentation, some different strategies you might be able to take away. Once you start doing that, there's going to usually, from my experience being a health coach, there's going to be a time where you have to reset. You stop doing what you wanted to do. Your intentions were good, but things got hectic. So you want to ask yourself, how long do you think it might take you to get back on track? And tomorrow may not be the answer. Sometimes it takes more time. For example, if you wanted to start eating healthy again, but you can't get to the grocery store until Saturday, so it's gonna at least take 2 days before you can get back into your routine. Um, or maybe the week is so hectic, there's no way I'm going to be able to do that this week, but I'll get back to it next week. So giving yourself the time you need, and plan and regroup to help keep that goal from, being in place for a lifetime. We all need to regroup from time to time. You can also scale back your intentions. So when you may already have a habit, let's say you exercise 5 days a week already, but things are going to be really hectic next month. You might be traveling. It might be May where school is out and there's so many different activities that the kids are trying to do by the end of the year. You could scale back and maybe say, you know what, for the next month, I'm only going to exercise 3 days a week instead of 5. And then once things get back into normal routine, I'll get back to my 5 days. This helps with consistency over time. It helps you to keep it on your radar for the week, but not also, putting that pressure on yourself to continue something that might not be doable.
That, and as one of my great managers, boss told me, you cannot boil the ocean in a day. And I know she's listening to this webinar right now, and that is always a good reminder. It's one day at a time, one day at a time. This is great. Thanks. I want to just start right here because I think this all really segues nicely into the newest epidemic in the United States, which we've heard about, is loneliness. And how a person defines loneliness really varies. Some people describe loneliness as maybe physical isolation or social disconnection. Others experience maybe a deep sense of emptiness or a longing for inclusion, intimacy, friendship, community. But this isn't new, but we have to think about the long-term effects, right? It's something we all need to start thinking about and how we really weave this into our well-being strategy. The new Surgeon General advisory says that lacking connections can increase risk of premature death to levels compared to smoking 15 cigarettes a day. And I know rebuilding social connections does not happen overnight, but we have to prioritize building these connections in the same way that we've prioritized other critical public health issues like tobacco, obesity, and substance use disorder. So our next polling question, we would love to know, what is your favorite way to build genuine connections with your colleagues? We've all had to rethink about loneliness and how we're kind of meeting together in this old virtual world that we live in. Do you plan team visits or in-person meetings? Maybe you host virtual lunches with your coworkers. Maybe you take talk and walk breaks with your coworkers. That's my favorite thing to do. Maybe you decide to take a group workout class, or maybe there's something other. So let's see what you guys have to say here. Oh, I love this. Planning team visits and in-person meetings and taking walk breaks with coworkers. I think this is great. Bria, let me send it over to you. What are some additional ways maybe that we can start creating these meaningful connections?
Yeah, absolutely. I think driving a culture of belonging, we're finding more and more in research, right, that it is helping to combat things like loneliness. And that's a big focus for us at Wellbeats, not only for our member experience. So we've built in ways to invite your friends, family, kids to do classes with you virtually. So that's something even our team internally as an organization, we've deployed a few things. We've done some challenges as teams. No surprise, we're very competitive. A lot of us are, but also in inclusive ways too. So driving those connections in a way that's going to meet people no matter where they're at, right? So having something inclusive like we have a lot of team members that live all over the world, actually. So we have global team members. So when we do in-person things, how do we involve the remote team as well? And I'm in the remote team, so I'm a big advocate to making sure that there's an inclusive aspect as well. And then on an organizational level, one other example I wanted to share with us is, we as a company came together with a few other groups over a year ago. And so one way we wanted to try to drive some relationship building and kind of helping to get to know each other. And the work that we're doing across the organization is we did 10-minute coffee breaks. It was voluntary, but if you wanted to, you could opt in. And then we had a group, a voluntary group that coordinated and matched you with somebody that you probably never would have talked to before, right? Maybe you're on a team that you wouldn't normally, interact with them, and literally had 10-minute virtual coffee chats, and you could talk about whatever you wanted. And it was funny. Some people wanted to talk about work, which was great. Some people just wanted to learn, about you as a person. But it was just such a fun way to connect on a kind of humanize everyone, right? Especially in this virtual world, is humanizing who we are, what we do for the organization, getting to know people on a personal level. And it's funny, people that I would have never worked with before, I met, and then we realized, hey, maybe we should be working together. I didn't realize you were doing this work over here, or I'm doing this over here. And, in the next month we were doing projects together. So there's so many, different ways you could approach it, but I wanted to share that one that I think worked really well. And I think our team enjoyed doing that. Again, those that wanted to opt into it participated in it.
I love that, Bria. Thank you so much. And we are running out of time. So I want to skip to the last polling question here for everybody. You guys have been blowing up the chat, which I just love so much. Thank you all so much for your participation. But we would love to know, what is something that you heard today that you want to put into action? Do you want to start using a resiliency plan? I saw somebody say they used to go on bikes with their husband and now they don't do it anymore. Maybe you want to trap it, map it, zap it, what Alana was talking about. Maybe you want to retrain your brain and not experience so many negative emotions. Maybe you want to set a better example for your team. Maybe you want to get outside more. Maybe you want to feel more confident to talk about your mental health at work. Or maybe you want to start a talk and walk with a coworker. So let's see what everybody wants to do. I'm kind of excited about this one. And then we're going to end on closing thoughts. You guys, we had such great information. We're not going to get to any questions today. But if anybody has questions, they can always email us at connect@webmd.net. And we will be happy to answer any of your questions and pass it on to Alana, Amy, or Bria. Let's see, what does everybody want to do? Okay, everybody got something. Everybody got something out of this, which is fantastic. All right, so let's get to closing thoughts. We have 3 minutes left. Alana, I want to start with you. What is one thing that you want to end on today?
Yeah, real fast. We know through McKinsey, Deloitte, HBR, that the future of work is going to require very different skills than what we have today. And the skills are things in the cognitive realm that we were talking about today, interpersonal skills and self-leadership. And these are all things that the science of resilience boosts. And it just makes me so excited because we have a pathway forward for us to not just survive at work, but thrive at work, thrive in our personal lives. And I'll leave it at that.
Coming off of mute. And what I'll add to that too is I think it's exciting to know that there are multiple opportunities to try something new, or have something that you want to go and try, whether it's on an individual level, maybe it's with your team, or an organizational level. Like if you're a manager and want to try doing some things with your team, there's so many different avenues and opportunities to try things, right? And work towards some of the tactics and strategies that we shared today. But there's so many more out there as well that are very effective. So I think it's just important that anytime you can make impact, and you can do it as an individual and then also scale that to a larger group as well. So anybody can make an impact.
I love that. Trying new things. That's a great way to, again, get that energy boost that you need. I would just like to leave with creating an intention for the day before you start your work day, and ask yourself, what is my intention for today? What do I need to make this day good or great? And what do I need for self-care in order for that to happen? And trying to remind yourself of the little things that you can do to make your day a little bit better.
I love that. Thank you all so much, Alana, Bria, Amy. Thank you for bringing your expertise to this topic. I hope everybody enjoyed it. We did get a couple of questions here. Bria, one person wants to know the Wellbeats app, how do you get an access code to that? It's asking for an invite code. So I'll follow up with you so we can follow up with that person as well. Another person asked, are we going to get these slides in this recording? Absolutely. Yes, you are. You should see that pop up in your inbox here. If not tomorrow, early next week. So you'll get the playback and the slides with it, along with those additional resource materials as well. But I just want to thank everybody so much for your participation. Alana, Bria, Amy, thank you for everything that you brought to today's webinar. There is the survey that's going to pop up for all of our attendees, so don't close out. Please make sure you fill out that survey. We appreciate it. Ladies, have a fantastic weekend. Have a great summer, and we look forward to seeing everybody on our next webinar. Thanks, everybody. Take care.
Thanks, everybody.
Thank you.
Thanks so much.